Influenza, commonly known as the flu, is an acute respiratory infection caused by the influenza virus. It typically presents with a sudden onset and pronounced systemic symptoms, such as high fever, headache, body aches, and weakness, while respiratory symptoms are relatively mild. Influenza is primarily spread through contact and respiratory droplets, with a high transmission rate. Mild cases usually resolve on their own, but severe cases may require medication and are generally treatable. The influenza virus infects the respiratory tract by using hemagglutinin, HA, to bind to sialic acid receptors on the surface of respiratory epithelial cells. Once inside the cells, the virus's genetic material is transcribed and replicated. New virus particles are continuously released with the help of neuraminidase, Na, spreading and infecting other cells. Infected host cells undergo degeneration, necrosis, or shedding, triggering systemic inflammation and potentially leading to complications such as acute respiratory distress syndrome, shock, and multiple organ failure. The primary source of infection is individuals who are ill, followed by asymptomatic carriers. Infected individuals can spread the virus through nasal secretions, saliva, and sputum for 3 to 7 days after the onset of symptoms, with the highest infectious period occurring in the first 2 to 3 days. Influenza is characterized by its sudden onset, rapid spread, high incidence but low mortality rate, and has a seasonal pattern, more common in winter and early spring in northern regions, and in summer and winter in southern regions. The main transmission route is via respiratory droplets, but the virus can also spread through direct or indirect contact with mucous membranes of the mouth, nose, or eyes, or through contact with contaminated surfaces. Influenza symptoms can vary. The typical type presents with sudden onset and systemic symptoms, often accompanied by upper respiratory tract symptoms. The gastrointestinal type includes abdominal pain, diarrhea, and vomiting. The pneumonia type may cause cough and difficulty breathing, and the toxic type can involve severe systemic illness, neurological damage, and cardiovascular issues. Patients should follow medical advice for medication, avoiding self-adjustment of dosages to ensure effective treatment. They should stay warm, add clothing as needed to avoid worsening the illness, maintain a clean environment with good ventilation, and use separate utensils from others in the household. Good personal hygiene is crucial. Wash hands frequently, cover coughs and sneezes with tissues, and avoid spreading droplets. General preventive measures include maintaining good indoor air circulation, avoiding crowded places during peak flu season, and staying away from individuals with respiratory infections. If symptoms appear or if there has been exposure to flu patients, one should rest at home and seek medical attention promptly. Practice good personal hygiene, wash hands regularly, avoid touching the face with unclean hands, and maintain a regular sleep schedule with moderate exercise to strengthen the immune system. Additionally, vaccination is the most effective way to prevent influenza and is a fundamental preventive measure. High-risk groups are advised to receive the vaccine annually.